Hi everyone, Dr. David Kulla here to discuss what is the vagus nerve. There are 12 cranial nerves in the body. They come in pairs and help to link the brain with other areas of the body, such as the head, neck, and torso. Some send sensory information, including details about smells, sights, tastes, and sounds to the brain. These nerves are known as having sensory functions. Other cranial nerves control the movement of various muscles and the function of certain glands. These are known as motor functions. While some cranial nerves have either sensory or motor functions, others have both. The vagus nerve is such a nerve. The cranial nerves are classified using Roman numerals based off of their location. The vagus nerve is also called cranial nerve number 10. Vagus nerve anatomy and function. The word vagus means wandering in Latin. This is a very appropriate name as the vagus nerve is the longest cranial nerve. It runs all the way from the brainstem to part of the colon. The sensory functions of the vagus nerve are divided into two components. Somatic components, and these are sensations felt on the skin or in the muscles. Visceral components, and these are sensations felt in the organs of the body. Sensory functions of the vagus nerve include providing somatic sensation information for the skin behind the ear, the external part of the ear canal, and certain parts of the throat, supplying visceral sensation information for the larynx, esophagus, lungs, trachea, heart, and most of the digestive tract, playing a small role in the sensation of taste near the root of the tongue. Motor functions of the vagus nerve include stimulating muscles in the pharynx, larynx, and the soft palate, which is the fleshy area near the back of the roof of the mouth, stimulating muscles in the heart, where it helps to lower resting heart rate, stimulating involuntary contractions in the digestive tract, including the esophagus, stomach, and most of the intestines, which allow food to move through the tract. Vagus nerve testing to test the vagus nerve. Basically, a doctor may check the gag reflex. During this part of the examination, the doctor may use a soft cotton swab to tickle the back of the throat on both sides. This should cause the person to gag. If the person doesn't gag, this may be due to a problem with the vagus nerve. The vagus nerve problems or nerve damage to the vagus nerve can have a range of symptoms. Because the nerve is so long, and it affects many areas of the body. Potential symptoms of damage to the vagus nerve include difficulty speaking or loss of voice, a voice that is hoarse or wheezy, trouble drinking liquids, loss of the gag reflex, pain in the ear, unusual heart rate, abnormal blood pressure, decreased production of stomach acid, nausea, or vomiting, abdominal bloating, or pain. The symptoms someone might have depend on what part of the nerve is being damaged. Gastroparesis is another one. Experts believe that damage to the vagus nerve may also cause a condition called gastroparesis. This condition affects the involuntary contractions of the digestive system, which prevents the stomach from properly emptying. Symptoms of gastroparesis include nausea or vomiting, especially vomiting undigested food hours after eating, loss of appetite or feeling full shortly after starting a meal, acid reflux, abdominal pain or bloating, or unexplained weight loss fluctuations in blood sugar. And some people develop gastroparesis after undergoing a vagotomy procedure, which removes all or part of the vagus nerve. Vasovagal syncope. Sometimes the vagus nerve overreacts to certain stress triggers, such as exposure to extreme heat, fear of bodily harm, the sight of blood or having blood drawn, straining, including trying to have a bowel movement, standing for too long. Remember, The vagus nerve stimulates certain muscles in the heart that help to slow heart rate. When it overreacts, it can cause a sudden drop in heart rate and blood pressure, resulting in fainting. This is known as vasovagal syncope. Vagus nerve stimulation involves placing a device in the body that uses electrical impulses to stimulate the vagus nerve. It's used to treat some cases of epilepsy and depression that don't respond to other treatments. The device is usually placed under the skin of the chest, where a wire connects it to the left vagus nerve. Once the device is activated, it sends signals through the vagus nerve to your brainstem, which then transmits information to your brain. A neurologist usually programs the device, but people often receive a handheld magnet they can use to control the device on their own as well. It's thought that vagus nerve stimulation could help to treat a range of other conditions in the future, including multiple sclerosis, Alzheimer's disease, cluster headaches, and many other neurological conditions. Finding the right neurologist for you is tough. You'll have to browse local neurologists that can help treat and manage conditions like this, like migraines, multiple sclerosis, seizures, and more. Choosing a provider based on your insurance coverage and location and provider credentials can all make this complicated. Chiropractors using cold laser therapy or low-level laser therapy, also called photobiomodulation, have amazing results at both stimulating and inhibiting the vagus nerve using cold laser or laser light therapy. And that's what we do here at Synergy Wellness. And we're able to get results pretty quickly using the laser to either stimulate or inhibit the vagus nerve. If you have any questions about the vagus nerve or any of the cranial nerves and you'd like us to do another video on another cranial nerve, we'd be happy to do that. I hope you got something from this video, and if you did, please subscribe and make sure you hit the thumbs up. Thank you again for following and for watching this video. We appreciate you. Thanks for tuning in.